It's time for Wave 3 Listens Live, taking your calls to hear what you have to say and hitting the streets to be live on location in your community. Now, Norton Healthcare presents Wave 3 Listens Healthy Living Live, brought to you with the support of Louisville Athletic Club.
And welcome once again to Healthy Living Live, coming to you as we always do, Westport Road, and it's the Louisville Athletic Club. Hi, I'm John Ramsey, joined by Bob and Caroline Scott. And what I love about this program is it's very comprehensive. We're going to take care of you medically, we're going to take care of you physically, and today we're going to talk about a little spirituality as well.
Yes.
Bob and Caroline, great show today.
Yeah,
lots of energy.
excited about it.
I love coming in here. As I said, not only are people physically working out, the energy level is high, the music is good, and the people are nice. And we've got a packed show today.
We really do. Just so much going on, John. I'm really excited about, you mentioned the spirituality aspect of it, because Sam Watini from the Lord's Kitchen is going to be here to talk about their upcoming thing that they do for Thanksgiving to benefit the poor in our community. And they have a severe need right now that we really need to get behind as a community and help them out, because they really do a phenomenal work.
Yeah.
And if you need a workout, you've got your buddy coming in today and he's going to help us out with a little some exercises that you can do at home, right?
I always have to work out on the show. They make me do it. But yeah, you know, the holidays is a time that we're very busy and it's hard to squeeze a workout in. So we're going to show you some multi-purpose stuff, you know, that you can get in a quick, workout during the holidays.
And something that I always love, a segment that we always do here at the LAC, we're going to talk about some good food as well, right?
Yeah, Jill couldn't make it today, so I will try to be as bubbly as her, but I don't know if that's possible. But I'm going to do a smoothie. So,
all right.
Yeah.
Bob and Caroline Scott, LAC, and I mentioned the show is very comprehensive, and that's because of our partners at Norton Healthcare. Today we're going to talk about a very serious subject, a condition that's really misunderstood, and perhaps we can clear some things up for you with the experts from Norton Healthcare. With me today, these two are the co-directors of the epilepsy program in the Norton Neuroscience Institute. Is that correct? All right. This is Dr. Zakaria. Dr. Zakaria, welcome to the show.
Oh, thank you. Thank you for having us here.
And Dr. Sun, welcome.
Thank you so much.
All right. We're talking today about, and this is a condition that's very misunderstood, we're talking about epilepsy today. And I have to tell you guys, first of all, I've got questions. I was talking to Dr. Sun a little bit before you arrived, and I was saying, first of all, what is epilepsy?
Well, that's a great question. First, John, thank you for having us again, and it's just so exciting for us to be here. November is the awareness month for epilepsy, and our goal with Dr. Sun and the epilepsy program at Norton is to increase public awareness of epilepsy and try to help as much as we can patients with epilepsy, because epilepsy is an extremely serious problem, and sometimes it can be very challenging to treat these patients. Back to your question, epilepsy is defined as a disease where you have a high risk of keep having seizures throughout your lifetime. Usually we call patient as epileptic or has epilepsy if he has 2 or more unprovoked seizures. And as I said, it's very common problems. It's the 3rd most common neurology problem we face in our offices. And it's next to stroke as incidence-wise throughout the nation. What I want you to know, John, is it's been almost a year since we've been here in the show, and it's been just a great year with Dr. Sun and the whole epilepsy team. And if you give me just a few seconds, I would be more than happy to summarize what we have accomplished over the last year. First of all, we established our epilepsy monitoring unit to make the correct diagnosis of epilepsy and try to help patients with different options for treatment-wise, including medication, surgery, or other type of brain surgery. We were able to help at least between 200 to 500 patients over the last year. Also, we were able to do between 7 or 8 epilepsy surgeries, and let me tell you something, 7 out of these 8 patients are seizure-free, and we're talking about patients who...
That's life-changing. That's great news.
Absolutely. I mean, those patients were having seizures almost on a daily basis, and for them to be seizure-free is a life-changing experience. I have a patient who called me a few months ago, and he said she's 50 years old, and she's been having epilepsy since she was 20, and now she's calling me to tell me she is trying to learn how to drive again and how to bike and how to live her life without being scared that she's going to have a seizure at any point. So we also tried over the last year to increase public awareness of epilepsy. So we've been working with the Epilepsy Foundation of Kentuckiana to increase patient awareness of epilepsy and with challenges that these patients have every day. Also, we were able to establish our first seminar to increase knowledge of epilepsy and how to treat epilepsy for primary care and nurse practitioners. So So it's been an exciting year, and we're looking forward for another year that's going to be full of accomplishment and help as much patient as we can.
So much good information, so much good news. Dr. Sun, I wanted to ask you a couple of quick questions. First of all, you mentioned the fact that if you have experienced 2 seizures or more, then you're probably you have epilepsy. Now, with that being said, is epilepsy genetic? Is this something that you can get ahead of as a parent, as someone who has a member of their family who may have epilepsy?
That's a fantastic question. It's one of the complicated factors with epilepsy is that there are so many different varieties, so many different forms of the syndrome. So there are forms of epilepsy that are without question genetic. You're born, there's something wrong with part of the brain cell, and you have a propensity to have seizures. Then there are a whole other category of epilepsy for patients that acquire it through the course of their life. And these are patients who may have had a stroke, they may have a brain tumor, they may have had an infection at some point in time, either their childhood or their adulthood. And between these two groups, you sort of have all this huge catchment. And that's where Dr. Zakaria comes in and sort of has to tease out what kind of epilepsy do you have, what are the risk factors that you grew up with. It's not something very frequently where a parent can say to themselves, okay, my child's definitely going to have epilepsy when he grows up. But there are some conditions that are definitely genetic in basis.
All right, so much good information. And once again, Norton Healthcare providing all of the answers. Now, these gentlemen are the co-directors of the epilepsy program for Norton Healthcare at the Norton Neuroscience Institute. I got all of that out correctly, didn't I?
That's amazing.
That is amazing. Believe me, it's amazing. But anyway, so much good information. We're live. It's Healthy Living Live, a comprehensive show. Today we're talking about epilepsy. Coming up more with the doctors. We'll be right back on Healthy Living Live.
Parents breaking the law for their kids.
Faking an address to get their kids into certain schools. It's happening in places you might not expect.
The Troubleshooter investigates how this growing problem could hurt your child's education. Tonight at 6.
Hi, I'm Tim Jones back for Toyota of Louisville. Right now, just in time for holiday travel, Toyotathon pricing underway. Brand new Corolla, payments as low as $88 a month. Selection over 40 to choose from. Log on from your own home, toyotaoflouisville.com.
Louisville Athletic Club has something for everyone who's looking to get in shape. Hi, I'm Bob Scott.
And I'm Caroline Scott, and you're going to love LAC's Resolution Solution.
For a limited time only, you can join the area's premier fitness center for less than $1 a day with no money down.
We have awesome programs to help you meet your weight, health, and fitness goals, and we'll help out your wallet with our best rates ever.
Hurry now and call one of our 3 area locations.
Or go to athleticClubs.org to start your Resolution Solution.
If you've been injured in an accident and are wondering, do I have a case? Go online or call the Tiger at Kaufman, Stigger & Hughes. Go to getthetiger.com and get the Tiger on your side.
You've been living with that ugly bathroom for so long. Now's the time to transform it for a fraction of the cost, only at Kentuckiana Rebath. Get the permanent solution with our lifetime warranty. We don't hire contractors, we do the work ourselves, so we know it's done right.
It's so easy to clean, it even stands up to our Dirty Brothers.
It's virtually maintenance-free. For a bathroom transformation from a faucet to full remodel, call Kentuckiana Rebath and get started today.
Now at Captain D's, 4 tasty seafood meals, just $4.99. Like our new colossal southern whitefish, crunchy bite-sized shrimp, hand-breaded flounder, or 6 pieces of coconut shrimp, just $4.99. Captain D's, flavor unleashed.
Wow, this water's really cold.
Got a little problem?
Know what else has been shrinking? The rates at Safe Auto.
Credit, no problem here at Toyota of Louisville. Tim Jones back out on the pre-owned lot. We always have at least 50 vehicles priced under $10,000. And if you've had past credit problems, chances are we can help you. $29 delivers any pre-owned vehicle this weekend. ToyotaofLouisville.com.
Go for the groceries and let Wave 3 pay the bill. Just register on the Wave 3 Facebook page. Then watch Wave 3 News at 5. If your name appears, call us within 3 minutes and you'll win a $100 Kroger gift card. So go for the groceries and let Wave 3 pay the bill.
Welcome back to Healthy Living Live. John Ramsey, along with the good folks from Norton Healthcare. In particular, right now, we're talking about the epilepsy, a very misunderstood, really a lot of questions, and we're going to handle those in a second. If you have a question, if maybe you have an epileptic in your family and you have questions, you've got the experts. These folks are the co-directors of the epilepsy program with the Norton Neuroscience Institute, Dr. Zakaria as well as Dr. Sun. Okay, question real quickly here.
Sure.
Diagnosis of epilepsy. How soon? How do you do it? What are the signs? What should people watch for if they think, you know, I may be epileptic?
Sure. I mean, that's a great question, John. Unfortunately, there is no single test that can tell you that you have epilepsy or you have seizures. Really, it's a combination of so many different things, and that's what makes it very challenging and very interesting at the same time for us. It starts with taking a very good detailed history. Usually, I take history from the patient himself, and then you need also history from the family, because most of the time the patient does not realize or know what he's doing during the seizure. So you need a good history, you need a good exam, you need a lot of imaging, like MRIs or sometimes more detailed and sensitive imaging. And then really the gold standard test is doing what we call epilepsy monitor, admitting the patient to the epilepsy monitoring unit. And what we were able to do over the last year is to establish really a state-of-the-art epilepsy monitoring unit at Norton Brownsboro Hospital. We have 5 beds and 1 ICU bed. And what we do is we admit the patient to the epilepsy monitoring unit, and we try to, we let them have a seizure while they are being supervised by the nurses and the EEG tech, and try to see where the seizure is coming from. And in this way, we will be able to see the patient in front of us having the seizure, try to get as much information as what the seizure for him looks like, and then also look at the EEG and see where the seizure is coming from the brain, and try to give the patient information about what will be the best treatment option once we get all this information.
You know, I think I speak for all of us when you've seen someone maybe at a public event or perhaps a family member at a private event and they have an epileptic seizure, you feel so helpless. And the good news is, Dr. Sun, the treatments, you've made great advancements. Let's talk a little bit more about the treatment.
Well, I think the first line treatment for someone with epilepsy is, once we've made the diagnosis, the correct diagnosis, is typically it's going to be medications. And that's where epilepsy neurologists like Dr. Zakaria come in, and they're going to work with the patient to tailor medications that will control the seizures while limiting the side effects of medicines. There are other things that we do, which is sort of lifestyle changes. Some patients find that if they're not getting enough sleep, they're more prone to having a seizure. If they eat certain foods, they're more prone to having a seizure. So there's a lot of things that we look at from lifestyle and diet as well that can actually help control somebody's seizures. But the mainstay of therapy is going to be medications. The problem with these medications is, just like any pill, there's good and there's bad. And these medicines have a lot of side effects. Unfortunately, not everybody responds to medicines. And what I tell patients is that if you failed 2 medicines, that's too many failures. Okay? And we have very good data from a lot of different research articles that show that if you fail 2 epilepsy medicines that have been appropriately dosed, that the chance of just throwing more and more medicine at you isn't going to help you. It's just going to delay you getting another therapy. And that's when a patient, we say that at that point that they have drug-resistant epilepsy. And that's very key. So that you have somebody who has epilepsy, you have somebody who has drug-resistant epilepsy. They've failed too many drugs, the drugs aren't working. At that time, you have to say, what other options are there? And surgery at that point becomes a potential option. At that point, they have to go through a surgical evaluation, which again requires epilepsy monitoring unit, requires MRI scans, lots of different kinds of pictures of the brain, neuropsychological evaluation. It's a very long road, and we tell the patients on the front end, we're going to walk you through a long tunnel. And the goal at the end of the day is to try to identify a part of the brain where the seizures are originating from that we can safely take out without causing you harm. And if we can take out that place where the seizures originate from, there's the chance that we can make you seizure-free.
Wow. Very exciting news, life-changing news, but as you said, advancements are still being made. We have a caller now, 571-5263. You have the experts at the Norton Neuroscience Institute. They're here, and they are the co-directors of the epilepsy program. And I think we have Brenda on the line. Brenda, welcome to the show. Brittany,
Hi,
I am sorry.
My name is Brittany, and I'm calling because my fiance has type 2 or type 1 juvenile diabetes. And he has seizures when his sugar bottoms out to the 20s or 30s, but he's a very fragile diabetic, and he doesn't per se have epilepsy, but he does have seizures quite often due to his diabetes.
So I guess that was more of a really a comment than a question, but with that being said, doctor, is this common, her case?
I have a few patients who do have epilepsy and do have diabetes, and this is a very kind of challenging area because we have to be sure that every time they have a seizure, it's really due to low blood sugar. It's not due to the fact they do have seizures in addition to diabetes. And I remember I had a patient who has both diabetes and epilepsy, and the parents were so convinced that this is only related to low blood sugar. So what we did is we admit the patient to the monitoring unit, and we watched him, and we kind of watched the EEG, and patient had a seizure, and we checked his blood sugar, and it was not low. It was actually really high. So we have to be very careful when we say that all of his seizures are related to low blood sugar or not. But obviously, if low blood sugar can cause seizures, so we have to be careful with this.
All right, Dr. Zakaria, Dr. Sun, once again, these are the co-directors of the epilepsy program. I got it out there, and we thank you for your calls. We'll be right back. LAC is the location. Healthy Living Live.
At the Floor Store, we're having our 50% off remnant sale this Saturday. Any size, any color, any quality. We have remnants starting as low as $10. But come in, because when they're gone, they're gone. First come, first serve at the Floor Store.
Now that I have Assurance, I can call our doctor. With Assurance Wireless, you get a free cell phone plus 250 free voice minutes each month.
Now that we have Assurance, we can keep in touch with our grandchildren.
You also get nationwide coverage and these calling features with no annual contract. Plus, it's easy to keep your current number.
To see if you qualify, call 1-800-378-7318. That's 1-800-378-7318. Or visit assurancewireless.com.
Mom, where do mashed potatoes come from?
Potatoes.
Where do potatoes come from?
The farm.
Did you get these potatoes from the farm?
No, but Bob did.
Who's Bob?
Bob Evans. This is his recipe.
He's a good cook.
I think so too.
For breakfast, for dinner, for generations, discover the farm fresh goodness of Bob Evans.
Guess where mashed potatoes come from?
Goss Avenue Antiques has something for everyone. The unexpected. A discovered treasure. Just what you've always wanted.
Veterans and enlisted military receive a 15% discount off mall-wide. No matter your budget, enhance your home for the holidays with special discounts on a wide spectrum of antique vintage furniture, decorative items, and fine art.
For special items that are uniquely you, experience Goss Avenue Antiques and Interiors for yourself.
At Norton Healthcare, we offer the best care and the best careers. We're committed to excellent patient care, and we need the right people to help us do that. Learn more and apply today at nortonhealthcare.com/careers.
Find your perfect ride at Clapp Volkswagen, featuring new models like the full-size Passat starting at $20,000 or the redesigned turbocharged Beetle, plus a variety of VW certified and foreign and domestic cars, trucks, vans, and SUVs. Clapp Volkswagen.
At the Floor Store, we're having our 50% off remnant sale this Saturday. Any size, any color, any quality. We have remnants starting as low as $10. But come in, because when they're gone, they're gone. First come, first serve at the Floor Store.
Welcome back to Healthy Living Live. We're at the LAC. Westport Road is the location. And today we're talking about, as I mentioned, a very misunderstood condition, epilepsy. I have Dr. Zakaria and Dr. Sun with me. And okay, we're going to cut to the questions because we have so many, and thanks for holding. Dr. Zakaria, how do you know if you're a candidate for surgery when it comes to epilepsy?
That's a great question, John. So like what Dr. Sun said, the first line of a treatment for patients with seizures or epilepsy is medication. And then when someone fails 2 or more medications, we know that most likely medication will not be able to get him seizure-free. And that's our goal, is to get him seizure-free with no side effects. So at this point, we think of what else we can offer him. And the second line of treatment that comes after medication that will be most effective after failure of medication will be the surgery. And here's the thing, is we have to do a lot of testing to be sure that the patient is a good candidate for surgery. I tell my patients all the time, surgery is not a guarantee that we can do. We have to be very specific and do a lot of testing to be sure that when we do the surgery, there's a very good chance, maybe 60 or 80% chance that the patient will be seizure-free after surgery. And that requires a lot of testing. It requires monitoring in the epilepsy monitoring unit, requires a lot of memory testing and as I said, a lot of pictures on the brain to be sure that the seizures are coming from one area in the brain that we can take out safely without causing any damage. And as I said, surgery can be a very effective treatment option in selected group of patients.
So maybe a complex process, but with what could be a life-changing outcome.
Definitely.
Okay. Dr. Sun, tell us a little bit more about the surgery and what's involved there.
Well, there are multiple kinds of surgeries, and I try to break them down into sort of two categories, really, to sort of simplify it. One is that we're really trying to remove that part of the brain where the seizures are coming from. And I tell people that's a resection, that we're actually going to take out a part of the brain. You have to remember, a seizure at a very basic level is where there's a part of the brain, there's cells in the brain that are firing very quickly that aren't supposed to be firing very quickly at that time. So if you can remove the problem, you can remove the epicenter of the earthquake, you can make the wave stop.
Makes perfect sense,
okay?
Yes.
And one kind of surgery is where we remove that part of the brain. The most common one being a temporal lobectomy. The temporal lobe of the brain is the one right sort of behind your eye and over here. That's the part of the brain that most commonly is having seizures for most people. And if we can safely remove that area, then there's a very good chance in the right candidate that we can cure them, essentially cure them of their epilepsy. Okay, and that's what it's about. If we can make somebody go from seizures once a day, once a week, once a month, to 0 seizures, we can really improve their quality of life.
All right. This is exciting stuff. Go ahead. I'm sorry.
I just want to mention the other side is sometimes patients aren't candidates for taking out a part of the brain, either because there are seizures coming from different areas, or that part of the brain it can't be taken out. It's controlling an important function of that person. We don't want to make seizures go away, but then have someone who can't talk or is paralyzed or something like that. So we can't let that happen. So in those patients, we have something called vagus nerve stimulation, and that's kind of like a pacemaker for the brain. It's a surgery. It takes about an hour. Patients go home the same day, and in that surgery, we put a little programmer right here in their chest, and it connects to a nerve. And basically, it sends signals to the brain to try to reduce the frequency of seizures. So those are really the two big categories of surgery.
Interesting, interesting. And many questions because, as I said, this is a very misunderstood condition. Jimmy is with us on Healthy Living Live. Jimmy, go ahead. You have the expertise of these two doctors.
Thank you, guys. Thank you for taking my call. The question I wanted to ask the doctors is that when you're on that medicine for seizures, if you do drugs or alcohol, does that increase your chances of having more seizures?
Well, that's a great question, Jimmy. Well, first of all, what I want you to know is that really what we need to do is we need to treat the seizures and at the same time provide you with the best quality of life. And if the quality of life means that you have a drink or two every week or two, that's perfectly fine. But my concern is that if you take this medication, you should not drink every day or drink more than 1 or 2 drinks per week, because that will increase the risk of side effects of the medication, increase the risk of having seizures, and increase other complications that might happen also. So everything in moderation is great. I don't want you have epilepsy, or you might have epilepsy, but I don't want epilepsy to have you. I want you to have a good quality of life, but everything in moderation.
Oh, I like that.
Yeah.
You may have epilepsy, but don't let epilepsy have you.
And that's what I emphasize to every patient is don't give up. There is always option. There is more research. There is more studies going on every day, and I'm sure one day we'll be able to stop epilepsy.
Okay. We have another question. Marie has been patiently waiting. Marie, welcome to the show.
Hi, darling. Oh, I love you both. I've seen you both. My name is Marie, and you might remember me. I'm with the Brain Tumor Foundation. But I had a lot of questions, but my main question is, when you have scar tissue and they cause simple partial seizures, which I obviously have them, is there any way that you could still have that surgery? Because I'm told that scar tissue from surgeries in the brain is causing a lot of the simple partial seizures, or maybe some more extensive type. Also, have you all done any studies on the blood type that you might have related to the medications for each patient that come to you and are given the medications? And I'll stop at that because I have so many questions, but thank you for answering me.
She obviously is very well educated in this field, I think. Yes.
I know her.
Yeah, I know her.
Hi. you know, we've talked in the office before. I think the take-home message is that whether it's scar tissue, and we have to be careful what we use when we say the word scar tissue. Okay, when you're talking about the brain, seizures only come from brain cells that fire. Okay, and those are called neurons. Those are the sort of basic fundamental part of the brain. So that scar tissue is irritating brain tissue. If that brain tissue can be safely removed, then there's a chance that we could help your seizures. But we'd have to do a lot of extensive monitoring and things like that. And that leads me to an interesting point. Sometimes we have to do surgery to figure out if we can do surgery. And that's where we have to actually take you to the operating room and put electrodes directly on the brain, and then take you out of the operating room with those electrodes still there, take you to the epilepsy monitoring unit. And I tell people it's kind of like you might have a black and white TV with rabbit ear antennas. Once we give you this kind of surgery where we put the grids on, it's kind of like having one of those fancy high definition TVs. Dr. Zakaria can get much more accurate data about what's going on. And that's sort of where this kind of thing would lead.
All right.
And
Thank you so
I
much,
just
Doc.
want to answer her
Yes.
second question very quick. Hi, Marie. So your question is like a great question. Is where the future research and the studies are going on right now. Try to use genetic and blood testing to find what will be the best medication to treat patients with epilepsy.
All right, Dr. Zakaria, Dr. Sun, thank you very much. We got to go to break real quickly. Healthy Living Live from the LAC. We'll be right back.
Louisville Athletic Club